Hello, how are you? My name is Last Chitumba. So, a lot has been said about the Röntgen and his historic discovery of X rays, but nothing much has been said about the evolution of ultrasound, evolution of medical ultrasound. So, today I am going to talk about the evolution of medical ultrasound. So, the theme that I'm going to discuss about is from birth to patient care, building blocks of ultrasound imaging. So in this presentation, I am going to discuss about the revolution of medical ultrasound from using the concept of birth to its scientific application in the diagnosis of various conditions using modern ultrasound equipment. So, the history of ultrasound started with Lazzaro Spinzalazzi from 1928 to 1799. So, he was an Italian psychologist, priest, who designed a set of experiments to explain how birds were able to fly at night. So, by studying the bird's ability to see and hear, Spinzalazzi noticed that if a bird was blinded, it was still able to fly confidently through space. However, when a bird was made deaf, even in one ear, it could not fly safely in the experimental environment. So we are talking about this great physiologist, Lazzaro Spinzalazzi, who was so much inquisitive. He had questions about how birds could fly even at night and they don't hit holes. So this inquisitiveness of this gentleman led to a greatest discovery, and it began the revolution of ultrasound that has taken us to this noble profession today. So the idea was borrowed from the navigation of birds. So this is the gentleman himself, Lazzaro Spinzalazzi, who was born in the year 1729 and he passed on in 1799. So he was an Italian physiologist and a priest. So we owe everything to this gentleman for his greatest inquisitiveness. He allowed himself not to live by observation, but he allowed himself to live by experimentation to find the answer to why and how birds travel. So it gave birth to the era of medical ultrasound that we are all in today. So on the basis of these findings, Spinzalazzi hypothesized that birds rely on sound, not their vision, to navigate. So it was only in 1938 when two Harvard students, Danford Griffin and Robert Columbus, coined the word echolocation to explain how birds generate high-frequency clicks that bounce off surfaces and then receive and use the retained echoes to calculate the exact location of objects within their environment. So you can see these two gentlemen, they were students at the time, very much inquisitive. So they coined the name echolocation to describe how birds could locate media and objects around them. and then they could navigate from one point to the other. So they are taking over from the great discovery of Spencer, who realized that birds, they use sound to navigate or to move from one place to the other, not the sense of hearing, not their sense of sight. So you can see how we are building it. So the word echolocation, that's how it was coined in the year 1938 by these Harvard students. Imagine at their age, when they were still students, they were very eager to experiment and find answers to how birds locate the objects around them and they don't bump into these objects. So the term is called echolocation. So echolocation is what we do today. How do we visualize internal organs? How do we visualize the kidneys? How do we visualize the pancreas? How do we visualize the liver in the bladder? This is called echolocation. So what are we using? We are using ultrasound. And where did it come from? It comes from the birds. The birds used to navigate or to move is what then was copied to discover medical ultrasound today. So now let's proceed and discuss on the beginnings of medical ultrasound, technology discoveries and the innovations behind them. So the first physician to use ultrasound for medical imaging was Carl Dusik. This was now in 1908 to 1968. He was an Australian neurologist who attempted to depict changes in brain ventricle size, secondary tumor growth. So in his early application of ultrasound technology, transducers were placed on both sides of patient's submerged head. So you can see that this gentleman is taking it further. So he's now trying to measure tumors in the brain using ultrasound. So back then, the images they produced, they were not so clear, they were hazy and filled with artifacts. But it was a revolution in making. So the sound wave were transmitted at a known rate from one transducer to another transducer by using a through transmission technique. The changes in the sound wave were recorded photographically on heat-sensitive paper, creating a two-dimensional representative of what was thought to be the patient's ventricles, referred to as a ventriculogram. So you can see the transitions. Although the findings from later experiments demonstrated that many of the echo variations were actually artifacts secondary to normal reflections and attenuations of the skull. This experiment was one of the earliest attempts to depict an organ in vivo. So you can see that this discovery was later on noted that they were artifacts. So most of the recordings, the images which this gentleman got were mere artifacts. But it was an evolution in the making. So this is the gentleman who started the use of medical ultrasound to identify tumors in the brain ventricles. He is Carl Dusik. He lived from 1908 to 1968. 1908 to 1968. So he passed on at the age of 60. Such great and memorable people. There are people that we don't celebrate. We only talk about X-rays. Sonographers, we also have got a role and a duty to celebrate our heroes, our forebearers, our forefathers in the noble profession that we are now part of. So, expanding role of ultrasound, current and future directions. So the field of ultrasound is allowed important strides in medical imaging, not only in the improved caliber of diagnostic imaging, but also in new and unique medical applications, driven by the groundbreaking historical and early medical advance of ultrasound. Improvements in sonography continue to provide innovative ways to detect, diagnose, and treat disease. So you can see the generational evolution of ultrasound from using the BET technology to where we are today, 5D technology, 4D technology, 3D technology, elastography, ultrasound contrast. So we've seen transitions over time. So it is our belief that with the time, more inventions are coming. So we owe everything to the technology that God gave to birds to navigate their way. It is that same evolution that has brought us to this profession today. We are very much able to visualize pathology, to visualize organs, to visualize congenital anomaly from the technology that we all borrowed from birds. Just like the technology that was used to make aeroplanes from how birds fly, so the same technology is the one that is applied to ultrasound from the birds. So using the principle of echolocation, birds, they produce a sound, they transmit the sound, and when that sound hits objects, it's going to produce an echo that comes back, and the bird can code that there is an echo that is coming from that depth or from such a distance, and then they are able to navigate their way and to avoid hitting objects when they travel in daytime or during nighttime. I believe that for lovers of ultrasound, you now have got a background of where our profession has come from, where we have derived the concept of using ultrasound. The go return time is coming from. It is coming from the technology of birds. So it is God adorned. How God has designed the birds and made them able to navigate their way is the technology that we are using today to produce images of the diagnostic essence and diagnostic importance. I thank you once again. My name is Mr. Euchi Tumba. I am a proud medical ultrasonographer, and I wish you have captured the history or the brief history of where our profession is coming from. The foundation or the genesis of our profession is coming from BET technology. I thank you so much.